Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Health experts in Edo and Kaduna State speak on recognizing COVID-19 in children and vaccinations. Yobe government flags off social equity program to provide succor for vulnerable persons during pandemic. World Health Organization says no current data indicates that COVID-19 booster jabs are needed. The Director General of the National Youth Service Corps, NYSC, has asked Corps members to get vaccinated against COVID-19. Addressing Corps members at the end of the 2021 Batch B Stream 1 orientation course, Brigadier General Shuaibu Ibrahim said, "Present yourself for COVID-19 vaccination. There is nothing harmful with the vaccine." This is as Nigeria took delivery of almost 700,000 doses of the AstraZeneca vaccine donated by the United Kingdom through the COVAX facility. Meanwhile, last night, Rivers State reported the highest number of infections with 170 cases, followed by Ondo with 38 and Gombe with 34 cases. The Nigeria Center for Disease Control, NCDC, reported 357 cases in 24 hours, an update which did not include data from Lagos. Let's take a look at the latest.
As Nigeria continues to battle a third wave of the COVID-19 pandemic, the Nigeria Center for Disease Control is asking Nigerians to ensure adherence to all non-pharmaceutical measures to curb the spread of the virus. The latest figures coming from the Nigeria Center for Disease Control are 357 confirmed cases reported from 11 states and the FCT, indicating a drop from the figures reported earlier. The latest update did not include data from Lagos, the epicenter of the disease. Rivers led the chart with 170 infections, followed by Ondo with 38 infections. Gombe registered 34. 20 cases were reported in Ogun and Ekiti State, while 18 cases were reported in the FCT. 16 cases were registered in Anambra. Oyo had 13 cases, Kwara had 10, while Imo, Bayelsa and Edo registered 6 cases each. There were 0 cases reported from Kano, Nasarawa and Plateau states. Nigeria now has a total of 183,444 confirmed cases. 149 people have been discharged in the last 24 hours, increasing the total number of recoveries to 167,459. The NCDC also reported 6 additional deaths from COVID-19 causes in the last 24 hours, raising the fatality toll to 2,229. Presently, there are more than 13,000 active cases in Nigeria, while over 2.6 million samples have been tested so far. In Africa, there are over 7.3 million confirmed cases and more than 185,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 208 million, while more than 4.3 million deaths have been reported.
And there are mixed reactions among citizens in Jigawa State regarding the need to adhere to the COVID-19 protocols as directed by the NCDC. Some residents there give some reasons why people might be neglecting the simple protocols such as wearing the face mask in public places. Our correspondent Sadiq Ilyasu has more.
There has been an increased number in COVID-19 cases, with more calls by the Nigerian Center for Disease Control to continue to adhere to all public health measures. The level of compliance with precautionary measures to keep coronavirus at bay by residents of Jigawa State is poor, as they move about major cities freely without their face mask on. While some think that COVID-19 measures should be taken seriously, others believe that there are more health issues of concern.
Before we thought it has gone, but all of a sudden we've now started seeing that too many people have started getting attacked. So there's the need for Nigerians, we particularly, to ensure that we adhere strictly to it, because we do that. If we don't do that, we'll be at a very great risk. People will just get attacked suddenly, and then before you know it, we are gone.
I'm not saying that the issue regarding COVID-19 personal protective measures should be ignored, no. But when you go to rural area and you start telling them that there is need for them to wear face masks, there is need for them to wash their hand, there is need for them to do that, they will look at you as a foolish. Because the number of people died as a result of cholera within 1 month are higher than the number of people died as a result of COVID-19 in the last 2 years. Therefore, the immediate challenge is what people are more concerned about.
The message of adherence to safety protocols is being reiterated by the state government.
To see that we still maintain basic hygiene in terms of hand washing, use of sanitizers in places that we have suspected where people are gathering in large numbers. So new variant, we are still on with the same protocol of protecting people, calling them to be on the watch out.
Since the outbreak of the pandemic, Jigawa State has recorded 562 with 16 fatalities. However, only 25 cases are still receiving treatment. Sadiq Ilyasu, Channels Television News.
And to Edo State, where the Director, Disease Control, Ministry of Health in the state says that COVID-19 in children is usually mild as the child's immunity tackles the disease. He's advising parents and guardians to ensure that their children in wards are well fed. He also spoke on the reasons behind non-compliance with the COVID-19 protocols and vaccine hesitancy.
When you look at it, COVID-19 disease is not very common in children, but that does not mean that it doesn't really affect them, because it's a respiratory infection, and while we are not putting more emphasis on children, is that when it affects them, it's usually mild, and they have a good immune system that counteracts it. That is why if you even look at World Health Organization, the plan for vaccination in some climes, like in African countries, in Europe, persons that are eligible to take the vaccines, they are above 18 years. So those that are below 18 years, they are not really captured, they are not targets, because it has been found that it is usually, when it affects them, it's usually mild and they come out of it. Just some countries have reduced that age to 16 years, like we know Canada, I think United States of America, they reduced their own to 18 years. But in children, not that it doesn't affect them, the data that we have in those states has shown that some children have been affected, but their cases are usually very mild.
Over in Kaduna State, the government has advised that children below the age of 18, pregnant women in the state, should be excluded from taking the COVID-19 vaccine until a time when all observances have been made. The state's Deputy Governor, Dr. Hadiza Balarabe, gave the advice at a sensitization, noting the dangers of the COVID-19 Delta variant in the country portends. She's advising pregnant women and other residents of the state to observe the safety guidelines for prevention.
Children under 18 should also be excluded from vaccination. And that is what we are observing here in Kaduna State and in other parts of the country. As for pregnancy is not a disease. It is not a disease. And the woman who is pregnant is just like me or you, only that she has some little bit of hormones, at higher levels than some of us here. And so if you come to talk about prevention of COVID in the pregnant woman, it follows the same regimen for everyone out there, right? And so use of mask, wash your hands regularly, avoid crowds, eat healthy, and all that, respiratory hygiene and all that also applies to a pregnant woman.
And for more on how the virus affects children, joining us right now virtually is Dr. Folashade Fadare, a public health physician with bias for child health. He's also medical director of Ibejuleki General Hospital, Akodo. Thank you so much for joining us on the program.
Hello, good evening.
Good evening and welcome. Tell us, what have you noticed? Has there been any increase pediatric COVID-19 diagnosis since the pandemic began?
Well, when the pandemic began, when we had the first wave, we were testing contact. So then we were able to get some pediatric cases. And so it was a clear indication that children also are also affected by the COVID-19 infection. But as we enter into second wave, now third wave, the testing is now for people that present. And so it is just high index of suspicion that, oh, this could be COVID. Or when we manage children and they don't improve on time, we think COVID.
Tell us about some of the symptoms. Especially, I mean, how true is it that young kids than older kids are more likely to spread the virus? Because that appears to be rather scary.
Well, what I just want you to know is that there are so many asymptomatic carrier. When I say symptomatic carrier, that is people that have the COVID in their nostril or their respiratory tract, but are not exhibiting any symptom like maybe coughing or sneezing. And you know, with children, coughing is like a normal thing for children. Children do cough for anything, they cough. So it would be wrong to say a child is coughing, it is COVID. Because it is, even when they have malaria, they cough. So coughing, fever, they are just not specific infection. You just have to have high index of suspicion, and that is why if you don't have symptom, you are likely to spread it because nobody will be afraid of you. When you see somebody that is very sick, you are likely to say, it could be COVID. But if the person is going normally, children are playing, you don't think COVID, and that is why the risk of spreading it is higher amongst the populace now.
Finally, and this is, the public health measures for schools. We know that, some schools are on holiday, but then there is summer school that appears to be ongoing. What are the expectations, school authorities, also in that sort of environment to prevent the virus spread?
Well, the expectation is same for everybody. We should, as much as possible, observe social distance. It is working and it works. If we have to go out, let us mask up. Let us have social distance, washing of hands, and if you don't have water, you could sanitize. And if you don't have to go out, please stay at home. And if anybody has symptoms or a child is sick, what we encourage that in school, they should have high index of suspicion so that once any child is sick, you encourage them to stay at home. Isolation for like a week is okay, and you are sure. So high index of suspicion, you keep children that are sick away, it will help to curb the spread. But I need to tell you, COVID is in our community.
All right, we appreciate your time. Thank you for that warning. Dr. Folashade Fadare is a public health physician with bias for child health, also head of contact tracing sub-pillar for COVID-19 Lagos State Response. Thanks for joining us on the program.
Thank you very much. Thanks for having me. Bye.
We have more on the global outlook of the virus when we return. Please stay with us. Welcome back. Staying in Nigeria, in an effort to provide succor to vulnerable persons during the coronavirus pandemic, the Yobe state government has flagged off the implementation of social equity program targeting over 32,000 women and children. Governor May Malabuni, represented by the Commissioner of Health, Dr. Lawan Ghana, reveals that the program will provide more access to free and qualitative health care. He further explains that the government has allocated 200 million naira for the program program specifically targeting pregnant mothers, children under 5 years, and accident victims.
The new equity program will provide more coverage for poor and vulnerable in the state to have access to free and qualitative healthcare services. The commencement of enrollment into the equity program marks the beginning of access to healthcare services by the beneficiaries of this laudable initiative by His Excellency the Governor of Yobe State, Honorable Mai Malabuni. The equity program will provide coverage for 32,930 poor and vulnerable beneficiaries, targeting specifically pregnant mothers and children under 5, including accident victims in the state who are expected to be electronically enrolled across the 178 political wards through the focal primary healthcare centers.
And protesters on Tuesday gathered in front of an Econo Fitness gym in Quebec to protest their use of a vaccine passport. Government officials say that Canada is working to create a digital vaccine passport that would allow citizens travel abroad, and it should be available in the next few months. According to the immigration minister, it is a key step forward in ensuring Canadians will have the documents they need once it is safe to travel again. In the meantime, the Canadian province of Ontario will begin offering third COVID-19 vaccine doses to vulnerable people as early as this week. Its chief medical officer said that eligible populations would include transplant patients along with residents in high-risk settings, including long-term care homes and Indigenous elder care lodges. Canada has one of the best inoculation rates in the world, with more than 82% of eligible people having had one shot and 71% fully vaccinated. Still, active cases are growing amid the Delta-driven fourth wave fueling the vaccine mandates. Well, joining us for more from Ontario, Canada, is Dr. Momo Osezua, a clinical research professional. Thank you for joining us on the program.
Yeah, thank you for having me, Millicent.
All right. Tell us, compared to the United States, how is Canada battling to stem the spread of COVID-19?
That's an interesting question. First off, I'd say that the Canadian government has done significantly well. I think globally, it's known now that the Canadian government has really done well in stemming the tide with regards to the pandemic. And kudos to the federal government and, of course, the provincial government, where, I mean, if you know Canada's healthcare system very well, most of the activities, the public health response and the pandemic response is done at the provincial level. And Ontario seems to be at the heart of that because of naturally it has the highest disease burden and probably it's probably the highest province with high traveling and transit from one province to another. So quickly, to address the situation in Canada as against the United States, I would say at the provincial level, they've done very well with case identification, or what we call case finding. First, because when you're looking at the pandemic and the response, you want to look at the key indicators. You want to look at the cases, how many cases you're having, active cases you're having, what is the hospitalization looking like, and then how many deaths that's coming out of that. And in terms of the identification and case identification, that has been truly amazing. The way people come into the country and active testing was going on. If you look at the past 7 to 8 months, the way it has actually progressed significantly. In January, we had very high levels of COVID-19 cases, active cases running, and we had this seem to have some kind of drop in February, and then March. But in April, there was a serious spike again, and the immigration minister, the transport minister had to curb people coming into the country. There were a lot of restrictions. They introduced the quarantine hotel systems where you'll be quarantined at a government facility for 72 hours, testing at the airports. Those entry points was really amazing how the province were able to really track that in conjunction with the federal government. Also, the land borders were still shut, and only essential services could move between the US and Canada. So that in itself has actually helped in terms of the public, from the government response side. We had a little challenge with hospitalization at some point because we had health workers who were overworked, long hours, because sometimes they get positive themselves and they have to, go out of the workforce for under 14 days. So that kind of put a strain on the workforce. But I think we have been able to overcome that now, especially with the vaccines. And then, of course, we've seen that the deaths have really dropped. Now we are talking about single-digit deaths numbers, maybe 1 or 2, 3 in a week. We're talking about hospitalizations at single figures. I think the last month we've not had more than 20 or 30 hospitalizations. So
let me quickly jump in there. And this is also, with further updates that we're seeing, the third dose vaccinations, which could begin as early as this week in some areas. We understand government is also mandating hospitals, long-term community care service providers, all employees, staff, students, volunteers, to provide proof of full vaccination, a medical reason why they're not vaccinated. I mean, it sounds like a lot of details. How are people reacting to this?
So one of the things I'll say about the Canadian the society, and especially Ontario, it's I will also give kudos to the residents and the citizens of this country, because there's been a lot of cooperation, I would say, and I think they've had a lot of patience with the government from the health side. So with regards to third dose vaccines, for example, and then the vaccine, more like if you want to call it that, mandatory vaccination, vaccine proof, vaccination proof rather. The health workers have come out, I think, as early as July. I think the Doctors Association, the Physician Association of Medical Association of Ontario, and then the Nurses Association of Ontario, to actually canvass for this, because they've already done internal, using they've done surveys and studies and questionnaires within their own spheres, and 98% of that or health workers already said they had already gotten the second shot already, and they were good with any proof that was needed. So with regards to the long-term homes, care homes, some kind of social services, and of course majorly the critical healthcare workers, they've not had any problem with that at all. It has not even been a problem. Funny enough, it has even been the government that has been pushing back on it, because they feel that that's like trampling and making it compulsory. And that's why you see that clause there that, okay, if you refuse for any reason, you could actually provide the reason why, and then maybe more education or something. But I know people's personal beliefs too could affect, but it's not like everybody's okay with it. But overwhelmingly, I can say that over 90% or 95% of people are very fine with that, and they are happy to they want to be safe and be safe for their families too. So that's not a problem at all. As regards to the third dose vaccine, it's actually on the way, because the studies that came up in July showed that they were folks with maybe transplants that had this kind of dampened immune systems needed a third dose. The studies actually showed that they actually benefited from the third dose. So that's why we're going ahead to do that third dose, booster dose. So that will be happening very soon. Minimum of 8 weeks, and then minimum of 5 months after the second dose, you get a booster dose for those with kidney transplant issues, and then maybe hematological cancers. Yeah.
All right. We appreciate your time. Thanks a lot. Continue to stay safe. Dr. Momo Osezua is a clinical research professional at Ontario, Canada. Thanks for joining us.
Thank you for having me, Millicent. Bye.
Bye. Well, here's more updates on the global updates. And this is starting with the World Health Organization's call to halt booster jabs.
As countries around the world announce plans to begin giving COVID-19 booster jabs, the World Health Organization says current data does not indicate that COVID-19 booster shots are needed.
Yes, there is enough vaccine. As of today, 4.7 billion doses of vaccine have been administered around the world. That will soon pass the 5 billion mark. So yes, there is enough vaccine around the world. However, it's not going to the right places in the right order to save as many lives, prevent as much severe disease as possible. And until that happens, it's difficult to understand the position that there is enough vaccine going to the places that that need it.
Meanwhile, the Chinese mainland has administered over 1.88 billion doses of COVID-19 vaccines as it further ramps up the mass inoculation drive covering wider age groups. The country has extended the scope of vaccination to people aged under 18, following the authorization by the health authorities in June of the emergency use of domestic inactivated vaccines among people aged 3 to 17. As Australia's largest city, Sydney, continues to break records for new daily infections, despite a nearly 2-month lockdown, authorities say the Delta outbreak has not peaked and residents must brace for more deaths.
Unfortunately, we had a huge increase in the number of cases of community transmission to 8 p.m. last night. There were 633 cases of community transmission, and at this stage there are at least 62 of those that were infectious in the community during that time.
Australia is in the grip of a third wave of infections that has exposed weaknesses in the country's vaccine rollout and forced more than half of its 25 million people into lockdown. And in neighbouring New Zealand, 2 new cases of coronavirus have been reported over the past 24 hours, taking the total number of infections to 7 in the latest outbreak. The cases have been linked to the outbreak in New South Wales, Australia.
The results that have come back from our case yesterday tell us 2 things. First, that we are dealing with the Delta variant. The second thing it tells us is that it is linked the current genome sequencing of cases in the New South Wales outbreak. Our case has originated in Australia.
And finally, Pope Francis has issued an appeal urging people to get inoculated against COVID-19, saying the vaccines could bring an end to the pandemic, but it needs to be taken by everyone. Pope Francis was himself vaccinated in March, saying at the time that it was an ethical obligation.
Let's all continue to take responsibility. You can visit our websites for more updates, a better understanding of the pandemic. You can also find some breaking stories. It's channelstv.com. Stay healthy. Thanks for watching. I'm Millicent Walker. Bye for now.